and on behalf of the Workforce and Family Program, I wanted to take a moment to welcome you to the New America Foundation. We're so pleased that you could join us today for this. Should be a very interesting and informative discussion on the racial and ethnic differences in child well-being. As last night the country's focused on the State of the Union, and for the last year at New America we've been focused on the state of well-being of children with the inspiration and support of the Foundation for Child Development. We've had an exciting year of events, and we're looking forward to another year next year, and we hope you all will keep us in mind as you think about events that look at children's well-being next year as well. But today we're going to focus on a specific report which we have been pleased to be a part of. Don Hernandez and Suzanne McCartney have worked on, and that report is available online. There's a flyer outside on your way out to get more information, and we encourage you to look at the websites for full information on that report. Don's going to explain in some detail some of the findings, which are maybe a little counterintuitive, and some of them show that as we look from 85, 93, even over the last 7 years, some different results for different areas of child well-being, but yet there are some areas we really need to improve on. And I hope with the brain power in this room we can have a lively discussion on how best to do that. To start us off, we've got a very experienced and strong group of individuals to help facilitate our event today. I'm going to introduce briefly individuals. There's more extensive biographies available outside. After Ken Land, who's done over the last year terrific work on the Child Wellbeing Index, and even in the past beyond that. After he and Don speak, we have 4 respondents who are going to give some perspectives, both on Don's work, but really more broadly on the issue of some of these differences that we see and what we should do about them. And then we're going to try to reserve as much time as we can for your questions and insights. But first, I'd like to take a moment to thank the Foundation for Child Development, which has inspired work for many people in this field, many people in this room, and certainly for us at New America. And I'd like to invite Fasaha Trailer up in a moment to deliver some remarks. Fasaha is the Senior Program Officer at the Foundation for Child Development. Her work is focused on helping to develop and promote the Foundation's Pre-K to 3 initiative. And among other things, she's developed grants for teachers, students, and young people in a variety of areas and oversees the Child Wellbeing Index. She is immediate past president of the board of the Philadelphia Citizens for Children, Youth, and board chair of the Grant Makers for Children, Youth, and Families. So I'd like to both thank FCD for their support and invite Fasaha for a moment.
Thank you, thank you. Good morning, everybody. At almost 110 years old, we're the oldest child-focused foundation in the United States. And since our inception, we've really strived to connect research with policy to foster needed social change in our country. I'm really glad to see everybody here, including some really good friends. And because this really shows us that what we expected the Child Wellbeing Index to do, it is doing. And that is that it provides regular opportunities for us to discuss the welfare of children in our country. We're grateful that Kenneth Land and Vicki Lamb and their team at Duke University responded so enthusiastically to the idea of establishing a Child Wellbeing Index almost a decade ago. The sheer intellectual effort that has gone into identifying data sets, variables, and methods has been phenomenal. And we haven't been disappointed with the kinds of analyses and insights that we've been able to glean from this work. The special analysis that we'll hear about today was conducted by Donald Hernandez and his colleague Suzanne McCartney, both from the University at Albany, which I always called SUNY Albany, but which it has now transformed itself. It's based on the CWI data set assembled by the Duke team. Their findings, or at least the headline, reminds me of something that a good friend used to say. It's not what you don't know that's dangerous. It's what you think you know that ain't so. Too many policymakers, parents, and citizens alike have operated out of the assumption that improvements in the life chances of poor and minority children were beyond our reach. Poor young people inevitably turn out to be criminals. Drugs and drinking are part of their natural environment. Baggy jeans and backwards baseball caps are signs of a mugging in the making. Today's analysis provides evidence that these assumptions may be part of what we think we know that ain't so. Young people, their families, and their communities have demonstrated that they can and that they will meet the challenges they face. Letting go of our assumptions about them is part of the work that we as a country must do in order to close the gaps that remain. But in addition to letting go of what ain't so, we also must align our policies with what we say we believe about the potential of the good kids. Every kid starts out as a good kid. So health insurance, sound early childhood programs, schools that are worthy of our children, opportunities to contribute to society, these are things we can do. But will we? It is our pleasure to have fostered the research that makes new insights and social change possible, and we're deeply grateful to the New America Foundation for their willingness to bring this data-rich resource to policymakers and the public.
Thank you. Thank you very much, Ms. Aha. Now I'd like to invite Dr. Ken Land up for just a moment. Dr. Land is the project coordinator of the Child Wellbeing Index, a professor of sociology at Duke University, the author of 5 books and hundreds of articles and book chapters that look at social trends and child well-being, both responsibility of parents and also policymakers. Giving us a little bit of background on the CWI is as critical as Don has based his research in the CWI. So I'd like to invite Ken to come forward, please.
Good morning. It's a pleasure to be here. When Ruby Takanashi and Fasaha Trailer approached me about a decade ago and said, you know, we do all this work to improve the well-being of children in American society, but how can we tell? Are kids any better off today than they were previously, or worse off, and in what respects? So we began an effort to develop what's now become the CWI, the Child and Youth Wellbeing Index. And we initially surveyed the literature on well-being studies, developed 7 domains of well-being. We identified a number of indicators that could tap into those domains of well-being. And we began with our first publication, scientific publication in 2001 in the journal Social Indicators Research. In that initial publication, we had a small segment of a long article that looked at race and ethnic comparisons, disparities, and changes over time. And I'm so pleased that Don Hernandez has picked up on that, because we were able at that time only to develop indicators up through 1998. Several years have passed since then, and more data points are available. And Don has taken what we did and expanded it in various interesting ways, developed new ways of adjusting and interpreting and presenting the data. And I look forward to his presentation today. Thanks very much, Don.
Great. Thank you, Ken. Dr. Donald Hernandez is professor of sociology at the Center for Social and Demographic Analysis at the University of Albany, as Fasaha said, State University of New York. Dr. Hernandez has served on numerous advisory boards and committees, is an expert in child well-being and sociology generally, and has done some terrific work here, which he's now going to give us some analysis and some summary of. I'm going to encourage you to take an opportunity to look at the report in some detail, but I'd like to invite Dr. Hernandez up with many thanks for his good work to enlighten us on his work here. Don?
Thank you very much, David, and also Ken and Fasaha. Good morning, everyone. Today, I'll be presenting new results regarding race-ethnic disparities in child well-being. I'll focus. There we are. Okay, I'll focus specifically on gaps separating black children and Hispanic children from white children, and on changes in gaps occurring between 1985 and 2004. I'd like to begin by acknowledging my co-author, Suzanne McCartney, and thanking the Foundation for Child Development for funding this research. I'd also like to thank the New America Foundation for organizing this event today. And finally, I'd like to thank Ken Land, Vicki Lamb, and their colleagues at Duke University, as well as Callie Renison, for sharing with us data that we use in this research. As you know, the U.S. is rapidly becoming a more racially and ethnically diverse society. According to U.S. Census Bureau projections, less than 25 years from today, no single race ethnic group will constitute a majority of children. Instead, the race ethnic minorities of today will, taken together, constitute more than 1/2 of all children, and many of these groups have experienced historical disadvantages in various domains of well-being. What does this mean for our country? I'd like to suggest that to avoid social fragmentation in the coming years, it's critical that we pursue the twin social goals of equality of opportunity and equality of life conditions for all groups. The FCD Child Wellbeing Index, or CWI, provides a valuable approach for assessing inequality in life conditions for various groups. For the past 4 years, based on the work of Ken Land and Vicki Lamb and their colleagues, FCD has released an updated CWI consisting of 28 indicators organized into 7 domains of child well-being. These domains are safety behavioral concerns, family economic well-being, health, community connectedness, educational attainment, social relationships, and emotional, spiritual well-being. Using this work as a starting point, our new report is the first effort to analyze for this 20-year period, or 19 years, disparities in overall child well-being through the lens of race ethnicity. Our aim is to better understand how differences between Black, Hispanic, and white children have changed since 1985 for key indicators of well-being. Our hope is that these results will help policymakers and others to reduce race-ethnic disparities and improve the lives of all children in this country. My brief presentation consists of 7 parts. First, I'll discuss the changing race-ethnic gaps in overall child well-being. Second, I'll analyze the components of these overall changes in terms of specific domains of child well-being. Third, I'll focus on specific indicators in the 2 domains of well-being that experience the largest changes. Fourth, I'll highlight specific indicators where Blacks and Hispanics have experienced advantages compared to whites. Fifth, I'll discuss specific indicators relating to education and voting. Sixth, I'll return to the overall index of child well-being and present results which suggest the number of years it might take to completely eliminate overall race-ethnic differences in child well-being. Finally, I'll close by presenting results that show where we would stand if race-ethnic gaps in overall well-being were eliminated and how far we would still have to go to improve the well-being of all children. Historically, Black and Hispanic children have lagged behind whites along many dimensions of well-being. Since 1985, however, the gaps in overall well-being between Black and white children and between Hispanic and white children have become smaller. Setting the CWI at a starting point baseline of 100 in 1985, we see in this slide that between 1985 and 2004, the overall quality of life of children as a whole increased by about 10%, with a value of moving from a value of 100 to 110. Most of this increase occurred after 1993. We also calculate CWI values for specific groups compared to the value of 100 for children as a whole in the baseline year of 1985. The results of these calculations for 1985 produce CWI values of 78 for Blacks, 87 for Hispanics, and 107 for whites. In other words, in 1985, Black children experienced a 29-point disadvantage compared to whites, and Hispanics experienced a 20-point disadvantage compared to whites. Between 1985 and 1993, Blacks and Hispanics both experienced small declines in their overall quality of life, while whites experienced no change overall. But then, between 1993 and 2004, all 3 groups experienced substantial improvements in well-being, and Blacks and Hispanics experienced greater improvements than whites. As a result, race-ethnic gaps in child well-being became substantially smaller. From 1993 to 2004, the gap separating both black children and Hispanic children from white children narrowed by 4/10, or about 40%. However, measuring change over the longer 19 years, from 1985 to 2004, the black-white gap narrowed by a much smaller 1/4, and the Hispanic-white gap narrowed by about 1/3. In other words, race-ethnic gaps in the quality of life became substantially smaller between 1985 and 2004, but large gaps remained as of 2004. What domains of well-being account for the partial convergence of CWI values for these groups? Changes in 4 specific domains accounted for the reduction in race-ethnic gaps, but the largest changes occurred in 2 domains, namely the safety behavioral concerns domain and family economic well-being domain. I'd like to discuss specific indicators in these 2 domains in some detail. The safety behavioral concerns domain is composed of 6 separate indicators, including drug use, which is presented in this slide. In nearly every year from 1985 to 2004, both blacks and whites were less likely than whites to smoke cigarettes, drink alcohol, or use illicit drugs. Thus, blacks and Hispanics were less likely than whites to engage in these harmful behaviors. In addition, black and Hispanic advantages expanded somewhat for both cigarette smoking and drug use. However, the largest changes in the gaps within the safety behavioral domain occurred in indicators concerning crime and teen births. This slide shows violent crime offender rates per 100,000 juveniles aged 12 to 17. Blacks were much more likely than whites to commit serious crimes in 1985, but the gap had nearly disappeared by 2004. Similarly, Hispanics were more likely than whites in 1985 to be victims of violent crime, but by 2004, Hispanics were less likely than whites to be crime victims. Turning to teen births, the gap separating blacks from whites narrowed by almost 1/2 between 1985 and 2004. As a result of these changes in crime and teen birth rates, combined with the black and Hispanic advantages in cigarette smoking, drinking alcohol, and drug use, the overall disadvantages for these groups in 1985 in the safety behavioral domain had been eliminated and in fact had been turned to small advantages by 2004. Excuse me. The second domain, accounting for the largest reduction in race-ethnic gaps in overall well-being, is the family economic well-being domain. This domain is composed of 4 indicators: family poverty, secure parental employment, median family income, and health insurance coverage. Poverty declined for all 3 groups, blacks, Hispanics, and whites, between 1985 and 2004. But blacks and Hispanics experienced much larger declines than whites. As a result, race-ethnic gaps were much smaller in 2004 than in 1985. Across these 19 years, 4/10, or 40% of the poverty gaps separating blacks and Hispanics from whites were eliminated. Secure parental employment is defined as having a parent in the home who is employed full-time year-round. All 3 groups experienced increases in secure parental employment, especially between 1993 and 2000. But blacks and Hispanics experienced larger increases than whites. As a result, the gap in secure parental employment separating blacks from whites was about 1/3 smaller in 2004 than in 1985. The gap separating Hispanics from whites was nearly 60% smaller in 2004 than 1985. In addition, the gap in health insurance coverage between Hispanics and whites was reduced by more than 1/3 during this 19-year period. These changes in poverty, secure parental employment, and health insurance coverage were much larger than the small increases in the gaps in median family income. As a result, the black disadvantage compared to whites in family economic well-being domain was about 27% smaller in 2004 than in 1985, and the Hispanic disadvantage compared to whites was 30% smaller by 2004. In the third domain of well-being, both blacks and Hispanics are advantaged compared to whites. The emotional spiritual domain is composed of 3 indicators: the suicide rate, the the proportion attending religious services, and the proportion viewing religion as important. In every year between 1985 and 2004, blacks and Hispanics were less likely than whites to commit suicide, and they were more likely than whites in most years to report that religion is very important and to attend religious services weekly. Indicators regarding school enrollment and school outcomes are much more mixed. At the earliest stages, pre-kindergarten enrollment for children ages 3 and 4 increased substantially between 1985 and 2004 for blacks, Hispanics, and whites. The increases were greatest for blacks, and by 2004, blacks had closed the pre-kindergarten enrollment gap with whites. Hispanics also increased their pre-kindergarten enrollment rates more rapidly than whites, eliminating about 1/3 of the disadvantage which they experienced compared to whites in 1985. At the other end of the educational process, however, the gaps have remained constant or expanded. The proportion receiving a bachelor's degree by ages 25 to 29 increased for all three groups, but the gap separating blacks from whites remained essentially unchanged between 1985 and 2004. For Hispanics, however, the gap with whites expanded by about 1/2. In 1985, Hispanics were 13 percentage points less likely than whites to have completed a bachelor's degree, but in 2004, the gap had expanded to 20 percentage points. During these years, average math test scores and average reading test scores changed little for black, Hispanic, and white children, and the gap separating black and Hispanic children from whites also changed little. Also among older youth, the overall likelihood of voting increased somewhat between 1985 and 2004. Focusing on specific groups, the increases for blacks were greater than for whites, and by the 2000 presidential election, blacks were more likely than whites to vote. Voting among Hispanic youth in 2004 was, however, at the same level as in 1985. Now I'd like to return to the overall trends in child well-being. Based on the past trends reported here, how many years might it take to close the race-ethnic gaps in child well-being? This slide presents two sets of extrapolations. Based on the most recent period, since 1993 for blacks and 1994 for Hispanics, when the race-ethnic gaps reached their peak, and since 1985, the first year for which data are reported. Assuming black and Hispanic children continued to make the advances that they made most recently between 1993 and 1994 and 2004, black children would reach parity with whites in 18 years, while Hispanics would reach parity with whites in 14 years. Based on the longer-term trends from 1985 to 2004, convergence would require more than 5 decades for blacks, 54 years, and more than 4 decades for Hispanics, 43 years. These results indicate, based on past trends, that it will take at least a generation, and perhaps 2 generations or more, to completely eliminate the gaps in well-being that separate white children from black and Hispanic children. Past trends show that enormous progress is possible, but continued progress is not guaranteed and cannot be taken for granted. Insofar as the narrowing of race-ethnic gaps has been the result of expanded or new policies and programs since 1985, additional reductions in race-ethnic disparities may require that effective public efforts be pursued in the future with expanded resources and renewed vigor. Child well-being will be improved greatly if the goals of equality of opportunity and equality of life conditions are achieved across groups. But additional progress is both desirable and possible. Ken Land, Vicki Lamb, and their colleagues have developed 2 best practice summary indexes using national and international indicator values as yardsticks. The National Best Practice Index uses as a standard the best value for each indicator ever recorded historically for the U.S. The International Best Practice Index uses as the standard the best value observed internationally in any country for which comparable indicators are available. Using the CWI value of 100 in 1985 as the baseline, the numerical value for the National Best Practice Index is 129, while the numerical value for the International Best Practice Index is 144. These index values are substantially higher than the value of 115 for whites in 2004. Therefore, even if black and Hispanic children reach parity with whites, the overall level of well-being for all three groups would have a considerable distance to go to meet the best practice level reflecting the historical experience of the U.S., and even further to go to meet the international best practice level. Thank you very much for your attention.
Thank you very much, Don. We now have 4 respondents who I would like to invite to come and join us at the table here. If you come forward, and I'll just take a moment. There's more extensive biographies on each of them, but we've got 4 individuals who can provide some, I think, very important perspectives from the federal policy community, the advocacy and research community, the academic community, and the think tank community, because this resource that Don and Susanna put together provides a launching point for a larger discussion. There's a lot of perspectives, a lot of work being done in the federal level, from the administration and the executive branch, at the legislative level, and at the state and local level, and in the community level, to try and work with parents to provide the kind of support that individuals need, but also the kind of policies that folks need. And so I'm just delighted that these 4 individuals could be able to be with us today. I'm going to introduce them all very, very briefly. They all have more extensive biographies available, but first, Melissa Pardue is Deputy Assistant Secretary for Health Human Service Policy in the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services. Prior to coming to HHS, Melissa was an Associate Director at the White House Council of Domestic Policy Council. Then Miriam Calderon will speak. She's the Associate Director of the Policy Analysis Center of the Office of Research, Advocacy, and Legislation at the National Council of LaRasa. She directs LaRasa's children's policy and advocacy work with a particular focus on early childhood education. Dr. Joseph Youngblood II is the Associate Vice President for Public Affairs, Dean of the John S. Watson School of Public Service, and Director of the John S. Watson Institute for Public Policy at Thomas Edison State College. And Julia Isaacs is a Children and Family Policy Fellow at the Brookings Institution and a First Focus Fellow. I'm very grateful that all 4 of you could be with us today. I'd like to first invite Melissa to come forward and provide some thoughts, and then we'll go forward there, and then we'll have your questions. Melissa?
Well, thank you, David, and good morning. I am very pleased to be here, part of what I think is a very important conversation on the well-being of youth in general, but specifically looking at disparities among different ethnic groups. It was very interesting to hear Dr. Hernandez's presentation and the indicators that they specifically tracked, and I think much of this is consistent with what we are monitoring in terms of the federal government's assessment of how our programs are improving child well-being. So most of my remarks today will focus on specifically how it relates to Department of Health and Human Services programs and how we also seek to address and improve child well-being in our service to youth and their families. So I'm going to focus my remarks on probably a couple specific areas, sort of looking at the economic issues and income and how that affects child well-being, early education, youth issues, which would include both violence and delinquency as well as childbearing, child welfare, which was not part of this index, but which we feel like is a very important measurement of child well-being, as well as touch on child health. Now, in terms of economic issues and income, obviously those are issues of great importance to the Department of Health and Human Services, and the main areas in which we work on this are obviously supports for working families, things like the TANF program, as well as child support, and then healthy marriage and family formation programs. Now, obviously, there are a lot of other important federal programs that address this issue that are have the purview outside of the Department of Health and Human Services, things like food stamps, WIC, school lunch, school breakfast programs, but I will leave that for another day since those are USDA programs. But so as Dr. Hernandez had presented, there are some important declines and disparities in this area among blacks and whites and among Hispanic and whites. And I think we have seen this consistently as well in trends that we track at the Department of Health and Human Services, particularly looking at current population survey data. And since 2001, we have particularly seen important declines in child poverty among Hispanics, decreasing from 28% in 2001 to 26.9%. And since 2003, the gap in child poverty between these white children and Hispanic children has also declined. The gap was 19.9% in 2003 and is declined to 16.9% in 2006, which is our last measurement of this. And between 2003 and 2006, the gap between white children and Hispanic children in the percentage of children living in poverty with incomes more than twice the poverty line, so typically the group we describe as extreme poverty, that group has also, the gap there has also declined. The number of Hispanic and African American children receiving child support, and specifically the full amount of child support due, which is an important factor in the in calculating child support, has also increased between 2001 and 2005. And again, between 03 and 06, the gap between the percentage of non-Hispanic white children and Hispanic children living with both parents has also declined, which is also a very important indicator of child well-being and income into the home with both parents there. So in terms of the TANF program, the major reforms during the 1996 welfare reform have worked to move millions of families from welfare dependency into self-sufficiency. Specifically, the number of welfare recipients has dropped 68%, from 12.2 million in 1996 to 3.9 million as of June 2007, without any increase in child poverty. And at the same time this was happening, and I know I said I wasn't going to speak about USDA programs, but I think it's important to note that at the same time, the food stamp program does continue to provide a very important and growing safety net for these low-income families. Program participation had declined in the early years following welfare reform, and there was some concern about both of those program receipt numbers declining, but outreach efforts and other initiatives since 2001 have dramatically improved access and participation in the food stamp program, and it now provides benefits to over 26 million people each month, which is about 1 million more than were being served in 1996. And so this represents about 65% of those who are eligible for it, and we're seeing Hispanics representing about 19% of that program receipt. So this is also just a very important safety net program. And I think what was interesting is that several of the principles of the TANF reform are actually consistent with what I think Dr. Hernandez showed in the child well-being measures, specifically in that TANF requires adult recipients to engage in work or work-related activities. It discourages out-of-wedlock childbearing and encourages responsible parenthood and two-parent family formation activities. So those are things that are also occurring sort of along with these important reforms in TANF and these important declines in the roles. We're also seeing a whole new set of activities at the Department of Health and Human Services relating to sort of family formation issues. And so specifically, the Healthy Marriage Initiative, which was started, it was initially part of the reauthorization package for welfare reform and has been implemented sort of over time, and most recently with grants in the Deficit Reduction Act for healthy marriage and responsible fatherhood activities. And I think important to this conversation today is mentioning that we now have specific aspects of the Healthy Marriage Initiative that are targeting racial and ethnic groups. We have a Hispanic Healthy Marriage Initiative, we have an African American Healthy Marriage Initiative, and a Native American Healthy Marriage Initiative. And so all of these are just basically adaptations of the Healthy Marriage message, the programming that has been sort of built and tested around the country for really over a decade now. Much of this activity was happening at sort of the state and local level in the 90s. This has now been adapted as a model for specifically targeting family formation and encouraging two-parent families in these specific racial components. I will just touch on early childhood education briefly. And as we saw in the paper presented, obviously there is very promising news in the area of preschool enrollment, which is very important, as the authors suggested here, that there may in fact be changes resulting from the expansion of publicly funded preschool programs during this period. Head Start saw rapid expansions in both the 80s and 90s across several administrations to the current level of over 900,000 children served through Head Start. State-funded pre-K has also been rapidly expanding in recent years. There are, according to some estimates, these programs are now serving more children than Head Start, in fact. So while that is certainly a very important bit of progress to report on early childhood, increased enrollment doesn't necessarily translate into increased well-being. If we just have more poorly performing programs, it's not necessarily going to equal the same thing as more good quality programs. And so policies have increasingly been focused on strengthening these programs to really benefit school readiness and ensure that these programs are preparing kids for learning. And the President's Good Start, Grow Smart initiative has really focused on strengthening Head Start and increasing collaboration between early childhood programs and increasing quality in all auspices of care through state early learning guidelines. And then we're also particularly pleased with some of the recent reforms in the Head Start reauthorization that was just passed by Congress several months ago. We do continue to be disappointed that the national reporting system was terminated as a real measure of assessment and progress in these programs, but we are optimistic, I guess, about opportunities for ways to do increased accountability and ways to use assessment to inform program improvement as we move forward in this program. And I would just recognize my colleague here from the Department of Education, who works very closely on the English language learners initiative, which has been a particular sort of interagency collaboration on specifically looking at the gap between white and Hispanic children in early childhood education. And so there are a variety of research efforts underway across the government, both at HHS as well as at Department of Education, that are looking for ways to build the knowledge base, identify assessment practices, curricula, and interventions for these English language learners. I will just touch briefly on youth and teen fertility issues. Again, I think we do see many of the same improvements that were highlighted in the paper this morning, specifically in childbearing and in violence. On birth rates, we have seen really significant declines since the early 1990s. And as the paper indicated, specifically these gaps between whites and blacks and Hispanics have been shrinking, which is just tremendous. In particular, though, the unmarried birth rate for teens aged 15 to 17 has been more than cut in half for black teens since 1991. And the unmarried birth rate for teens, those older teens, age 18 and 19, also fell very sharply between 1991 and 2003. And since 2001, the black-white gap in unmarried birth rates for teens has also been closing. In terms of policies in this area, obviously there's been a lot of activity and there's a lot of attention paid to sort of the programmatic aspects of birth rate and fertility issues. The administration has been big supporters, obviously, of abstinence education programs, which were introduced actually well before. In 1996, welfare reform was actually the first program and have been expanded since then. But the support for these programs has certainly not been at the expense of other approaches to supporting teen pregnancy. HHS operates a wide variety of programs and grants to both state and federal programs for demonstrations on prevention of teen pregnancy, STD, HIV prevention as well. And a couple other programs I think that often don't get talked about as much, but are, I think, important aspects to this child well-being piece, particularly around fertility and childbearing, are things like maternity group homes, which have been funded in the last 7 years to provide a range of coordinated services to both pregnant and parenting teens, and are really building out of our runaway homeless youth shelter system, and have expanded that to specifically target pregnant and parenting teens. And as of our last count, in I think 2005, we have about 15 of these homes funded through our shelter system to date. So, and obviously another important measure, as was touched on in the Hernandez paper for youth well-being, is looking at violence and delinquency measures. And again, the data here do indicate very good news on this narrowing of gap between blacks and whites on violent crime, particularly since 1992. I think we've seen sort of the steepest decline. HHS is involved in many of the activities that relate to this and sort of the interagency collaboration that occurs between the Department of Justice and other agencies on this. HHS is an active member of the Coordinating Council for Juvenile Justice and Delinquency Prevention. Our agency, SAMHSA, Substance Abuse and Mental Health Services Agency at HHS, has a variety of drug treatment programs designed to specifically break the cycle of alcohol, drug abuse, and incarceration by funding treatment as a part of juvenile justice activities. Finally, HHS is a sort of a key participant in the 8-agency effort of Helping America's Youth, which the President announced in the 2005 State of the Union and has asked Mrs. Bush to lead since then, which really is designed to engage communities directly. And there have been regional conferences around the country, and there has been, out of the initiative, the development of a community guide for Helping America's Youth, which is basically an online training tool that will help communities identify resources, federal resources in their own backyard that could be brought to the table to address at-risk youth in their community. This is federal programs across HHS, USDA, Department of Education, Department of Justice, HUD. All of these would be pulled up on a map, and communities could sort of come together and identify the resources and also get information about how to form a coalition in their community, how to involve business, nonprofit leaders to come to the table and invest in youth-serving programs that could deal with particular issues that community is struggling with. So that has been a really important, and I think really the signature initiative over the last several years that has really looked to address these issues of at-risk youth, particularly addressing some of the violence and delinquency issues that we're seeing. And so I will just quickly touch, in the interest of time, on child welfare. Although it wasn't talked about in the Hernandez paper, we at HHS do feel like this is obviously a very key measure of child well-being, and there have been some significant improvements in foster care for both Hispanic and Black children. The proportion at the end of the year foster care population that is non-Hispanic African American decreased from 39% to 32% between 2000 and 2005. And for Hispanics, the proportion of children adopted from foster care increased from 15 to 18% from 2000 to 2005. And there have been several programmatic changes that have been associated with some of these gains in the child welfare area. We've had an increased focus on outcomes for children in foster care, particularly through the Child and Family Service reviews. There's also been improvements in adoption performance that have really followed the Adoption and Safe Families Act of 1997 to really increase the number of adoptions directly out of foster care. And several states have also established guardianship programs, either through demonstration waivers or directly through their foster care program that enables more relatives to take custody of children who would otherwise have remained in foster care longer. And then just finally, child health, which obviously health is a big aspect of the services that Department of Health and Human Services provides. And there are really sort of two, I think, key initiatives here over the last 7 years that have really been instrumental in addressing child well-being as it relates to health, and those are health centers and the Healthy Start program. The Health Center Initiative was a 5-year presidential initiative that began in 2002. And since that time, 1,200 communities, 1,200 communities have had new or expanded health centers, and the number of patients seen at these centers has grown by over 4.7 million to a total of more than 15 million. There are about 4,000 delivery sites around the country, and a majority of health center patients are members of racial or ethnic minority groups, and over 90% of these patients seen have incomes below 200% of the federal poverty level. And then the low birth weight issue that I think we see as a major factor in child well-being is actually lower at these health centers than the national averages. And despite the fact that these centers serve a population that is overwhelmingly minority, we do see lower rates of low birth weight babies than the nationwide average. And then finally, the Healthy Start initiative, which actually began in 1991, is focused on primarily areas that have high rates of infant mortality. And so these are grant programs that go directly to these areas, about 38 different projects around the country here, and targeting specifically the infant mortality and other poor infant health outcomes. And just a couple of examples of how this is an incredibly successful program at really addressing some of these gaps is the Central Harlem Healthy Start Project, which began in the early 90s. And when it started, its infant mortality rate was 27.7 infant deaths per 1,000 live births. And by 2003, the infant mortality rate had fallen to 7.3. And the provisional rate for 2004 was actually even lower, was 7. So these Healthy Start programs are a real, tangible way to really address what we see as a huge health disparity and often an overwhelming minority disparity in terms of infant birth weight and infant mortality. So that's just the briefest overview of sort of the HHS perspective on child well-being, and I look forward to sort of related comments from my panelists. Thank you.
Thank you, Melissa. Maria?
Hi, good morning. Can everyone see me over the podium here? I want to just begin by thanking New America, the Foundation for Child Development, the research staff, Dr. Kenneth Land and Don Hernandez for putting this, making this data available and really putting a spotlight on these issues of racial and ethnic disparities in child well-being. Obviously, an issue of great concern and importance to the National Council of La Raza and a big part of the work that we do. Today, I'm going to talk really focus mostly on our perspective on the racial and ethnic gaps, or the gaps for Hispanic children. And there's a couple points I want to touch on. One is that the narrowing of these gaps need to be understood in context, particularly the realities that we know Latino children are facing today. And that, two, the solutions that we put forth need to be targeted. Our public policy conversations need to take into account the specific barriers faced by Latino children if we want to make real progress. And an important part of that are issues related to language, culture, and immigration. And I'm going to really attempt to be brief because I would love to have a rich time for rich dialogue during Q&A. And I'm going to attempt to make some kind of football reference as I go through this metaphor. I'm a New York Jets fan, so I know about mid-course, going into the locker room and changing your strategy, because they're very bad for those of you that don't like football. So the narrowing of the gaps, I think while it's clear that some progress is been made, I think it should concern us all that if we apply this essentially the same strategy, it would take at best a generation and at worst 4 to 5 generations to eliminate the gaps between white and black children and Hispanic and white children. I think we can see from the data that the bulk of the gap narrowed between 1994 and 2004. During this time period, we enjoyed economic prosperity. During the Clinton administration, we saw the creation of the Child Care Development Block Grant, the state children's health insurance program, huge increases in expansion in Head Start, early Head Start, and boost in K through 12 funding. And I don't think we are going to make an argument that Latino children don't benefit when Title I funding gets a boost with the creation of SCHIP, Head Start, or when the economy is booming and our parents are working. However, I think from this data we see that during this this time, arguably one of the best times for kids in the last couple of decades, that the narrowing of this gap was very modest and that there was just a slight uptick. And I think that this should give us all pause and really is the conversation today should be about a new playbook and a new strategy. So, David asked me to talk about solutions, which I want to talk about. And I think as part of moving us towards a new solution and a new playbook, I think we have to acknowledge that Hispanic children face vulnerabilities that need to be part of the public policy conversation. Issues related to immigration, issues related to their language status, issues, cultural barriers, and these need to be a focus of the public policy debate. And then real nuances, I think, come into play, and more and more people need to be aware of those. And let me just give sort of a Head Start example of why I think that there needs to be a playbook change. Head Start, terrific, our nation's premier early childhood program, incredible program, high quality. It saw massive, major increases sort of for decades, and certainly most recently in the 1990s. Hispanic children were historically underrepresented in the Head Start program, even during times when funding was boosted for this program. It wasn't until we started focusing administrative changes, a lot that was undertaken on the part of the Department of Health and Human Services began in this Clinton administration and continued in the current administration to address outreach barriers, issues around culture and language that were preventing Head Start children, Hispanic children, from fully benefiting from the Head Start program. I'm excited and proud that the new law that was signed by President Bush, incorporates many of the things that have happened administratively, and we are seeing huge boosts in the enrollment of Hispanic kids, and Hispanic kids are almost at parity. But it took, almost the lifespan of the Head Start program for Hispanic children to enjoy equitable participation. And I think that, that's an argument that the policy debate was focused on funding, and the advocacy community was focused on funding for this program. Even despite huge boosts in funding, we weren't going to see Hispanic children benefit from that program until we had a conversation, and a nuanced conversation, about what the real barriers were for those kids. So what are some of the new realities today? I mean, despite some broad trends showing, progress, I think we have to, understand some of the realities. One, the health domain was one of the main drivers of progress for Hispanic kids. We know that about a third of our Hispanic preschoolers are obese. This is despite, these children also being some of the kids with the highest rates of hunger in our nation. Insurance was also an indicator. 40% of the uninsured kids in our country are Latino kids. Education, we obviously know there's a huge Latino high school dropout crisis. And then on issues of economic prosperity and poverty, we recently did a report that Don Hernandez assisted us with, which we found that 2/3 of our Latino infants and toddlers are born into families at 200% of poverty, 2/3. With respect to solutions, I think that the solutions are there, and they're available. I think we know what to do. We know what the elements of a playbook would be. It's a matter of if we are going to focus the attention and make this a priority, make those solutions a priority in the debate and a focal point in our conversations. I think it's concerning that we're moving into an economic downturn. I think some of the statistics that I just referenced, sort of, which are drawn from more recent studies and more recent data, demonstrate, as I noted, that Latino children in times of economic downturn are going to face some vulnerabilities. We need to be aware of those, tackle them head on, make it a priority. The other concern as we move forward and we talk about solutions is immigration, and what are going to be the new voices if we really want to address the narrowing of the gap for Hispanic children. We've known for a long time that issues around immigration, who can be in this country and for how long and for what privileges, and also how immigrants are treated when they're in this country, is inextricably linked to child well-being and the well-being of Hispanic children. As was referenced in 1996, many major changes were made with respect to immigrants and their ability to integrate and get support from federal safety net programs. And we know that even when kids are citizens, Hispanic children, and they are eligible for these programs, the status of having at least one immigrant parent is going to create major barriers to their benefiting from these safety net programs. I think that for we have to start talking about those not just as a status event and looking at immigrant children or children in immigrant families and saying this is a risk factor, but we need to start talking, what does that mean as folks that care about children and are advocates for children? Does that mean that we have to join in the voices with respect to how we set the policies, and do we need to be more vocal about sending a message that as long as we make some of these programs contingent on issues related to immigration, that our children, citizen children, are going to be harmed along the way. Another issue with respect to immigration that is increasing focus of our work at NCLR is how the issue of who can stay and for how long. And the immigration policy debate has certainly been a big focal point, and many of you may be wondering why are we talking about immigration policy if we're talking about child well-being. We recently released a report with the Urban Institute that showed that 5 million children, 2/3 of whom are U.S. citizens, have at least one parent who's undocumented. Right now we have a policy in place around enforcement that, and we've seen several large-scale worksite raids that have taken place in many communities. We know in the report we did with the Urban Institute that there are clear and direct links to child well-being, their participation and enrollment in school, their mental health, and their increased likelihood of economic hardship. I think we need to be talking about those issues, and as an advocacy community, we need to be reminding people about the costs of some of these other policies to the well-being of our children. And last, I think, with respect to issues of language and culture, we need to remove these issues from what we would say are sort of boutique issues. Those are nice, those are kind of the window dressing, but the focus of the debate is really somewhere else and not there. And I think, to give an example of that, I'll come back to the issue of Title I. We're not going to make an argument that Latino children don't benefit when Title I funding is boosted. Clearly, a large number of Latino children are concentrated into Title I schools. But there's another title, Title III. Kathleen Leos is here, my former colleague Melissa. That there's a whole entire title that is dedicated to ensuring that these children, English language minority children, English language children, or children, Latino kids, about half of them in our schools are ELLs, have access to quality instruction, to the right types of assessments, to the right types of teachers, to the best methods of instruction that we can provide, and we know from the research is most effective. If we're not boosting Title III funding, we're not targeted, we're not moving towards narrowing those gaps. And I think that is sort of what I want to put out today, and I hope that we can talk about, is how do we get more organizations, more diverse voices talking about a strategy that is targeted, laser sharp, and focused on addressing these gaps. I think it's going to mean more voices weighing in on immigration, more folks developing expertise and including these issues in their advocacy priorities. And I think given the demographics, as Carol has said, in this country and the Hispanic and African American children being the emerging majority, we're going to have lots of reason for concern. I didn't mean to end on a bad note, but sorry. The solutions are there. So.
Thank you. Dr. Youngblood.
Good morning. Thank you, David, and thank you to the New America Foundation and also to the Foundation for Child Development, as well as the other collaborating partners for this opportunity to talk about some issues that are passionate and poignant for us all here this morning. Again, my name is Joseph Youngblood II, and I am Dean of the newly minted John S. Watson School of Public Service at Thomas Edison State College in New Jersey, where I have for the past 5 years been serving in the capacity as Executive Director of the college's Public Policy Institute. It is that work, and primarily the work of the Center for the Positive Development of Urban Children at the Watson Institute, that provides the conceptual framework and the context for much of what I will discuss this morning. In the time allotted this morning, I hope to achieve 3 primary objectives. 1, to promote knowledge of the strategies that we've been able to utilize in the state of New Jersey to help reduce and eventually eliminate disparities in pre-literacy and education outcomes that might appear among different racial groups, different cultural groups, and children and families for whom English is a second language or with limited English proficiency. Secondly, to discuss culturally responsive, multi-generational, whole family strategies to increase educational outcomes and attainment for all children. And thirdly, to identify policy strategies to overcome race, culture, and class disparities that are inherent barriers to early literacy and to third grade reading proficiency for all of our children. As a backdrop for my comments, I would like to emphasize and illuminate some of the findings in the report that I think provide a critical backdrop to many of the themes and issues that I'll be addressing this morning. One, it's pretty clear that the ethnic groups who are currently behind the gap are and will soon be in the majority. That raises very interesting implications in relation to how we are structuring systems and creating conditions that allow all of our children, irrespective of ethnicity, class, or race, to bear out in our system. Secondly, that we must place a higher value on the well-being of racial and ethnic groups given the demographic changes and the global marketplace. The bottom line is that as a nation, we can't afford to settle or to continue to promote practices that allow for the development and exacerbation of a current and existing underclass. And so finding ways to raise expectations for all of our children and again to create conditions that allow them to be able to function and prosper at higher levels is absolutely critical. Third, there has to be greater accountability and collaboration between local and state government to close the achievement gap. And I would add to that greater collaboration between the systems, institutions, and structures that provide services and resources to children and families, to include parents and families, schools, public and private agencies, and all the places where we live, work, and worship. And the basic reality, as stated by my colleague, Ms. Calderon, we certainly cannot wait a generation to eliminate these disparities that exist in the education and the educability of all of our children. And so that raises some tremendous issues around what this represents and how we begin to shape the conversations around literacy and educational attainment for all children. As a board member-elect to the Foundation for Child Development, and Fasaha did a wonderful job of explaining the organization's history and aspects and elements of its mission. One of the direct elements that impacted me most was many of the social justice tenets that rest within the mission of the Foundation for Child Development. This issue is a social justice issue, and we have to begin to see it and treat it as such. Dr. Hernandez and his colleagues did a wonderful job of framing much of the conversation around the demographic shifts in this country and what that represents to the systems that are responsible for educating our children. But in the state of New Jersey, we are also experiencing rapidly changing demographic shifts that have created some really interesting opportunities, but also some really interesting challenges. As a school lawyer, an educator, and a policy professional, New Jersey 10 years ago was the best place in the world I could be. At that time, the landmark court decision of Abbott v. Burke was still in litigation. It had been in litigation for 30-plus years. It required, once the court finally held a decision, a $9 billion school construction act. Again, millions of dollars to deal with issues of equity and the tax base in New Jersey, and with education policy being at the epicenter of the policy debate in New Jersey because of all these issues, New Jersey was a very interesting place and continues to be as we continue to ferret through and search for solutions in relation to these issues. David also asked me to come today to talk about some of the gap areas and to attempt to identify some of the solutions that we've been able to utilize in New Jersey as we attempt to deal with the issues that our country is dealing with nationally in relation to the education of all of our children. And one of the critical gap areas that we've been dealing with at the Watson Institute for Public Policy centers around the issue of cultural competency, particularly in New Jersey's designated Abbott districts, 23 of the poorest and most densely populated cities in the state of New Jersey. Current data trends lead us to project that there will be a drastic decrease in the number of Hispanic and African American teachers in New Jersey's most racially and ethnically diverse cities. Myriad reasons such as availability of supports and resources, in addition to the failure of some of those teachers to meet the mandates of both Abbott and No Child Left Behind, speak to the decline. Data also indicate that these teachers, many of whom are extremely experienced in terms of their knowledge of the cultural context, but also in terms of the number of years that they've been in the field, are going to be leaving, and we also know that they're going to be replaced by younger, predominantly white female teachers. The need for culturally competent teachers and practices in New Jersey could not be more important at this stage and phase of the state's development. In terms of a personal commentary, most of the leaders in the field of early care and education, myself included, are certainly advocates for and embrace the trend nationally for universal pre-K and also for demanding higher levels of professional education and development for teachers. At the same time, however, it's important that the push for higher levels of professional development and education means that the system as a whole must continue to pay attention to the diversification of the workforce and making sure that local colleges and universities are ready to enroll students who may not speak English or have a lot of prior education. Not to mention the more in-depth conversations around what supports are needed. Ana Berdecia, who heads up our Center for the Positive Development of Urban Children, is here today. And when we brought her on board, her work specifically was designed to assist teachers around the state, primarily early childhood educators, with navigating the state's professional development system and also to provide them with the supports they needed to meet the mandates of No Child Left Behind in Abbott. After over 4,500 personal conversations and interventions with teachers, we identified some really clear themes around some of the supports that were needed to support these teachers. And again, for the sake of time, we don't have the opportunity to go into that, but we certainly would love to engage you around what some of those systems, kinds of issues represented in terms of the barriers that many of the teachers were facing particularly those who were from ethnic minority and underrepresented backgrounds. So let's briefly talk about the New Jersey landscape. Again, Dr. Hernandez and his colleagues did a wonderful job of framing the national landscape, but I thought sharing some data that were New Jersey-specific data would sort of help paint the context for the intervention that we identified in terms of one of the strategies and solutions that we've been utilizing to deal with these issues in New Jersey. Here are data that we think underscore the need for cultural competency training in New Jersey. One, the number of language minority students from K-12 in New Jersey is approximately 290,000 students. The number of limited English proficient students is approximately 62,000, and these students speak approximately 167 different languages. The number of districts that serve our LEP population are 471 out of 620. That's right, you didn't hear that incorrectly. There are over 620, and by some estimations, even 630 public school districts in the state of New Jersey. Out of those 471, and mind you, we're talking about a state of approximately 8 million people. So again, really interesting implications, again, in terms of issues of privilege, poverty, wealth, and where those concentrations lie. Only 81 of those districts offer bilingual education programs. 52% of the children, preschool to third grade, population in districts and community provider settings are English language learners. In Abbott districts, approximately 80% of the students are children of color. Only 50% of the teachers in those districts represent the same ethnic, cultural, or linguistic backgrounds as the students they educate. To address these issues, the Center for the Positive Development of Urban Children at the Watson Institute received foundation and corporate funding to implement summer institutes for early care teachers throughout the state of New Jersey. The Cultural Competency English Language Summer Institute was launched in August of 2007 for early childhood educators across the state. The pilot allowed teachers from classrooms from each of the 3 regions in New Jersey to attend a 3-day summer institute followed by 6 months of one-to-one mentoring and coaching. In the 6-month post-institute evaluations, classroom transformations were seen in 3 areas. 1, classroom designs that built a stronger connection between home and school for the children. 2, teacher knowledge on culturally responsive practices and strategies for English language learners. And 3, teacher practices that improved second language acquisition while supporting the home language and culture. Other classroom improvements included labeled areas and materials in English and home language, greater presence of cultural props and use of language, books, music, posters, etc. that were directly related to the specific cultures of the students, and extended conversations both in English and home language that were more intentional and a part of the curricular design. In relation to effective strategies at the policy level, the Institute has been working closely with all of the major stakeholders in the state of New Jersey to advance research-based policy solutions and perspectives to end disparities in education. The issue of funding and funding formulas has consumed much of the policy debate in New Jersey. In fact, the Education Law Center was in litigation last week in relation to issues with the School Construction Corporation as well as with the governor's newly approved finance and education funding formula in New Jersey. One thing we're clear about, however, is that this investment in our children is and has been absolutely necessary. When we look at the short-term implications and results and outcomes of Abbott, many of the direct achievements and benefits have been more closely identified in the area of early childhood education. For example, data collected over the past 6 years shows significant gains in the quality of New Jersey's Abbott preschool programs, which significantly improve the language and early literacy skills of children. Children's vocabularies and the development of them increased their ability to engage in language experiences, and again, we saw drastic improvements across the longitudinal period that we followed these kids. And again, we're identifying here all of the students who participated in the fullness, if you will, of Abbott in terms of the universal preschool aspect of that through fourth grade. And lastly, and most significantly in some instances, the fourth grade test scores increased by almost 70% of those students who were participants in the fullness of Abbott and its implementation. There are also a few policy implications that are worth noting as I close. One, the recruitment of highly qualified teachers of color who speak multiple languages is absolutely important, not just in New Jersey, but around America. We've been working directly with collaborations, the National Council of La Raza, the National Black Child Development Institute, to specifically address the issue of cross-cultural recruitment of teachers and also, again, the issue of cultural competency. We've also been working directly with several state agencies, the Hispanic Directors Association in New Jersey, as well as the Department of Education and the Department of Human Services, again, to ratchet up the level of recruitment of minority teachers and also teachers who are bi or multilingual to make sure, again, that that element of the workforce and its demands are met. We must also address many of the systems issues, particularly in relation to how we create a greater degree of gap closing within the multiple agencies that impact and have direct control over resources to our schools. More specifically, and my closing point will be that when we look at the federal landscape in terms of education policy, certainly there is ample representation of the issues that are important at that level. We certainly have those same conversations at the state level. What we have found in our work and the body of work at the Watson Institute over the course of the past 15 years as we work directly with mayors is that rarely do the policy and practice messages reach that aspect of local decision making. That is a critical part. The mayors, and we've worked closely with the U.S. Conference of Mayors as well as the New Jersey Conference of Mayors, the New Jersey Urban Mayors Association, and the League of Municipalities to make sure that we're providing opportunities to educate and inform the mayors and the local decision makers who have tremendous influence and control over resources, transportation, zoning, licensing, and also in some instances direct control over schools and school boards. So translating the message and making sure that it reaches the multiple levels is a critical part of being able to identify best practices and to advance policies that will again help us educate all of our children. Thank you.
Julia?
You can do it.
Does this sound quick?
Good morning. I also would like to thank the New America Foundation and the Foundation for Child Development for inviting me to come to this talk talking about racial disparities in child well-being. David asked me I'm going to do something that's going to broaden the conversation a little bit or move it a little bit to talk about cross-generational impacts of child well-being, how it affects adult outcomes. I want to start by acknowledging Pew Charitable Trust, which funded this work, as well as my colleagues at Brookings, Belle Sawhill and Ron Haskins, and actually you can see there's a lot of people that helped out with this work, although I'll retain responsibility for the errors. This is work on economic mobility, and what I'm going to talk about is the economic mobility of black and white families, which is one chapter out of a forthcoming publication that will be out in less than a month. Actually, the ones in blue are already out. They came out in November, economic mobility of all families, of men and women, and of black and white families, which are all based on the PSID data, and I'll be speaking about those reports. My colleague Ron Haskins came out with a study in July on economic mobility of immigrants, and as you can see, we have further things to come out in a few weeks. So really quickly, what did we find? This is by economic mobility. I'm talking about how mobility across generations. And what did we find? When we looked overall, we saw that 2 out of 3 Americans are doing better than their parents did, which is what you would sort of, this is after you adjust for inflation, they have higher income than their parents did. And this is what you would expect over the generations with economic growth, that each generation would do better. However, when we looked at it more closely, and we looked at men's incomes, it was very flat. And so it was women coming into the labor force, and women's incomes that was driving up family income. So some of our growth in family income is primarily due to the rise in 2-earner families. And then the piece I'm going to talk about today is when we looked at how children were doing as adults, we found that family background had a very large influence on children's economic success. And particularly they were looking at the influences of income and race. So what I'm going to give you a few more statistics in case you haven't had enough today. And they're going to be drawn from the panel study of income dynamics, which is sort of unusual in the sense that it's a longitudinal study, and it went out in 1968 and got a bunch of families and interviewed them, and then interviewed the same families the following year. And then when their children left home, kept interviewing the parents, but also interviewing the children. So we have data every year for what their income was from 1968 till now. And I looked in the sample, I'm going to look at all people who were children in 1968. So when I say children, I really mean like people like me who are more in their 40s and 50s today, but the second generation. And I'm going to compare their income in late 90s, up to 2002, which is the last day I had data for. There's now data for 2004. And we're going to average across 5 years to get a sense of children's income, and then compare it to their parents' income. We'd really like to compare sort of lifetime income, but 5 years gives you a pretty good average. So looking at children's income when they're adults, back to what their parents' income was in the late 60s. And in both cases, my children are going to be average age of 39, their parents were average age of 41. So I'm measuring people's income when they're at their about their lifetime earnings. Now, I only have 2,367 individuals in the sample, and so I'm only going to be talking about white-black differences. I don't have large enough sample size to speak of Hispanics and other ethnicities. Let me just say a brief word of how this relates to what we've been hearing. So we're both looking at well-being. I'm going to be focusing on family income, not the other areas of economic well-being. I'm also going to be looking at families across the income spectrum. And I'm going to be comparing these childhood circumstances to adult circumstances. And also, even though I'm using data over time, I think there was a trend in the CWI, because it was looking at sort of like 10-year-olds reading in 85, 10-year-olds reading in 86. It's different children in each data point. I'm following the same children and looking at their income over time, so I don't really have a trend. I can't tell you how children growing up in the 40s did, because they aren't in my data in 1968, and I can't tell you how children growing up in the 80s are going to do, because they're not 40 yet. And I can't tell you anything about, I'm looking at families that were here in 1968, so I'm only going to have immigrants if they happen to immigrate before 1968. I don't have recent immigrants, and I don't have data on Hispanics and Asians. So here's my data. This is to get the context. There's the children's generation, parents' generation, the children's generation. Like the middle of the income distribution back, this is all in 2006 dollars, so everything's inflation adjusted. But back in 1968, the parents' median income was about $56,000. Those were parents who were right in the middle of the income distribution. And now, in the late 90s, the middle of the income distribution for these parents and children was more like $72,000. So that's showing you an increase in income. And I'm going to focus a lot on this middle income group that for the parents is between $49,000 and $65,000. That's family income. So if the parents are married, it's both the mother and father's income. Let me jump to the findings. So just to get you oriented, that middle bar there is those children whose parents were in that middle group between what I say 49,000 to 60-something thousand. And those children, when they grow up, about 19% of them have income at the very top of the income distribution, 17% have income at the very bottom. So they're sort of spreading out pretty equally. Each of these quintiles, by definition, it would be 20%. And children in the middle are going about equally across the income distribution. But if we look at the far left, that's children whose parents had income at the bottom of the bottom fifth, bottom quintile. And we see that 42% of them, when they're adults, are also at the bottom. So showing that your parents' income does seem to have an influence on where you end up. If we look at the other end of the income spectrum, those whose parents were at the top quintile, that was more than 80,000 back in 1968, 39% of them themselves end up at the top of the income distribution. So this is showing this is not necessarily causal. There could be other things besides income, but it's showing the influence of income on where children end up, of parents' income, the relationship between parents' income and children's income. Okay, so now this slide's pretty interesting. I hope you can see it. Well, I'll explain it if you can't. First of all, there aren't enough blacks in the top of the income distribution for me to show you reliable data, so I've just blanked out that piece of it. That's probably because there were fewer blacks who made it to the top of the income distribution in 1968. It's also the way the sample was drawn. They did an oversample of blacks at the bottom of the income distribution, so we'd have enough people to do reliable statistics. Look at the extreme left. That's children at the bottom of the income, children whose parents were at the bottom of the income distribution. So for whites, 31% stay at the bottom of the income distribution. For blacks, it's 54%. So if you were a black child in 1968 whose parents were in the bottom, half, 54% themselves remained in the bottom, compared to 31% of whites. So that's a racial disparity. Now look at the middle group. That's where the white children, those are the ones sort of more in blue, about 20% go to the top. It's 15%, 16% to the bottom. But again, the white children whose parents start in the middle, some of them go to the top, some of them go to the bottom. Now, for the black children whose parents were in the middle of the income distribution, these are not poor children, 45% of the children fall down to the bottom quintile, which is a huge difference between the 16% of white children and 45% of black children who, when they grew up, did not have as high family incomes. In case you couldn't read all those charts, I now have the words. This says the same thing. As we said, the children in the middle went sort of spread across the income distribution. However, for poor children, this is for all races, 42% who were at the bottom stayed at the bottom, and only 6% made that sort of rags to riches climb in one generation from the very bottom to the very top. For black poor children, 54% stayed at the bottom and 4% went all the way to the top. And perhaps the most startling finding of this report was that for black children whose parents were in the very middle, 45% fell to the bottom and only 8% went to the top. These are all, I should say, these are all family incomes. And so this is, that was measuring where you were on the income distribution, your family income. This is now measuring how you're doing compared to your parents, which is another way of looking at mobility. And as I said, 2 out of 3 children, that's the very top, 2 out of 3 children have higher income, family income, than their parents had. Now this is showing it for whites and blacks, and I've circled the biggest difference was for parents in the middle, whereas 2 out of 3 white children had higher income than their parents. Only 1 out of 3 black children had higher family income than their parents. It also was true in the other quintiles that the difference wasn't quite as large, but still was large, where in each quintile, white children are more likely to do better than their parents. Now that's as far as my report went, actually. Took us a year to put together all these statistics. Since we've presented the report, a lot of people say, well, why? And that was not a subject of the report. So I'm now going to speak on sort of some more suggestive, less definitive things to what's going on. I think it's important. One reason I did this report is we often talk about black-white differences, and they're really income differences. And so I thought, well, let's look at just children at different income levels, and then we'll be seeing black-white differences, not mixing in like the poverty difference, because as you know, there are more black children who are poor. So some people say, well, maybe you still have some big income differences. Maybe the black families are still much poorer than the white families. But no, in the middle, my median for white families in the middle is 56. For blacks, it's 54,000. I don't think that $2,000 is driving the difference. But it is important to realize that families who are in the middle of the income distribution, the black and white families do have a lot of differences in wealth, education, family structure, grandparents' income, what neighborhoods they live in, their social networks, their attitudes, the attitudes of society toward them. And Tom Hertz of American University has done some work where he controlled for a lot of the parental characteristics, and he found that this black-white difference in mobility was reduced but not eliminated. Now I'm going to jump really quickly over some slides that show the differences, so I'll just flash through these. But this is, if you look at the middle income here, this is not my data, so it's a different definition, but 50 to 75,000. black families had only 39% as many assets as white families, even when we're controlling for that being in the middle of the income. If we look at college education, again, this is those families, this is now from my data, this is families from the middle. I'm actually using the second to the fourth quintile to have a larger sample size, but 17% of the white parents had college degrees and only 4% of the black parents. So there was an education difference despite having the same income. And their children, you can see both generations had an increase, both races had an increase of the generations in education, but the black children still have less education. So I'm going to jump a little bit to get to my policy. This is the social network showing that the black children who are in the middle, only 8% of blacks were in the middle. So if you had social networks within your same race, if you were black, many of your peers, racial peers, would be below you economically. 85% were in the bottom two quintiles. There's a big difference in marriage rates. The parents who were in the middle, both the white and black parents were basically married, 96% to 90%. But their children, only 71% of the white children were married, and only 37% of the black children, the second generation, were married. My policy implications, there are a lot of policy implications you could think of to try to address some of these differences. I would focus on education and wealth. Those were two of the differences that were still there between white and black families, even when controlling for income. I just would say about education that it's not just K through 12, although I think improving teacher quality in urban schools is important. And it's not just helping people get a college degree. You really need to go back to early education because some of these racial gaps show up very early on. And on wealth, this actually is something I found on the New America website, proposal to work on children's savings accounts. This is a proposal where children get a savings account just when they're born and have a Social Security number, and then as parents put in money, government would match it. And also default enrollment in retirement savings. I think I'll skip my last two slides in the interests of Q&A. I said a little bit more about I'll jump to the very end. Early childhood education, and I have a paper that talks about the types of early childhood education I would recommend. I think this would help in the racial gaps at the bottom, because these would be programs targeted at the bottom of the income distribution. I'm less certain of policy responses for this gap in the middle income and what government should do about that, and I'd be interested in other people's ideas.
Thank you, Julia, and thank you to all the panelists. As you can see, we've been very fortunate for their perspective and knowledge. There's a lot of work being done at all sorts of levels on the issues that Don raises in his report. And in the 15 minutes we have left, I would love to invite your questions. I'd love to first invite Don to come up. Join the group. I'll stand, and you may have questions specifically on Don Cicino's report about methodology or implications, or for any of the panelists at this point, and let's get a conversation going. So why don't we take questions from you and get some Q&A. We'll go in groups of two if we could. Yes, sir.
I have a question to Melissa Perdue and other panelists, which has to do with the alleged success of welfare reform, which is to say that if the take-up rate of the TANF program is less than 50% at this point in time, then most of those forfeited beneficiaries are children. And if an indicator of poverty is not 200% of poverty, but those families who are 50% of poverty, how successful has our social policy been with respect to the most vulnerable children in America?
And when I ask your question, please identify yourself if you wouldn't mind.
David Stace.
Okay. And your organization?
Policy America and Virginia Commonwealth University.
Okay, great. Well, we'll do them in groups of two if we could on the questions. Is there a second question for anyone? Or yes, Carol.
Carol Brunson-Day, I'm with the National Black Child Development Institute. In terms of the big patterns that we have seen in the report, we see, I think, three. Either everybody is traveling in the same direction, either up or down, everybody meaning whites, blacks, and Latinos, or the gap gets larger or the gap gets smaller, the distance between the two. I think we've heard a lot about the things that the panelists feel help to shrink the gap in terms of direct policy and direct programs directed to the groups of color. And I'm curious about the thoughts about what kinds of things increase the distance between whites and these groups of color.
Okay, great. All right, so the first question in terms of welfare reform, Melissa, was directed to you, but others after you maybe want to address it, and whether it's really helping the most vulnerable children. Melissa, do you want to start?
Sure. Is this on? Okay. Well, in terms of the point about the roles declining, I mean, I think much has been made, and much initially was made when we were starting to see this trend downward in 2005. Sort of the question was posed, well, are people just being kicked off the rolls and going somewhere else? And I think because what I had talked about, we didn't see those similar increases in child poverty during that time, that was not the case. And I think the other thing that's very important to point out and remember about TANF is that this is a block grant program to states. It's currently operating at about $16.9 billion with a B annually. So this is money that goes to states. Each state gets a share of that proportion of their caseloads and percentage of folks under the federal poverty level. When rolls decrease, like they have decreased significantly over the last 11 years, the size of the block grant does not correspondingly go down. The state is given the same amount of money to administer their TANF program, whether or not they have 3 million people on the rolls or whether or not they have 1 million people on the rolls. And so as we've seen caseload declines, states have been able to really creatively use money for a lot of different things as a way to provide assistance to families. So we don't see resources declining, and we don't see poverty increasing consistent with the decreasing rolls in TANF. I do think it is important to also point out that there are, and I don't have the numbers in front of me, but the composition of what we look at in the TANF caseloads has changed, and there is a category of caseloads, and this is actually a growing category that we define as child-only caseloads, where the parents are not the actual recipients of the TANF check. It is for the child in that home. And so that is an increasing resource that we see being utilized in the TANF program, that the program is going directly to the children, not necessarily the parents, because for whatever reason they are sort of above the poverty line, but we can identify the child and provide resources that way.
Okay, great. Let's think about Carol's second question then about what's causing some of the gaps to increase along the line. I don't know. Don may have a thought on that, but do any of the panelists have a thought on that? Or to pick up on the other question, I think Don may have a thought on it in a second.
Yeah, we're just looking to see where the gaps were increasing because we really didn't focus on those. And just as a quick look, there are a few where there's small increases. The only one that I really noticed in a quick look back through the graphs is residential mobility, where there's been a big increase in residential mobility for black children compared to white children. So the overall story is, and I think this is probably a surprising one, there aren't big increases in the gaps except perhaps in an indicator or two. With regard to residential mobility, I'm not sure. I mean, perhaps it's related to welfare reform, in effect requiring or encouraging African American families to move more, but I don't have a very good handle on that.
Very interesting. All right.
I could speak about why the gap in family income is, well, it's not decreasing the way we would hope. And if you look separately at black men and black women's earnings, black men's earnings are really not increasing. Now, black women's earnings are increasing, but white women's earnings were increasing even more over this time period. And I think it's because a lot of black women were already in the labor force back in, say, late 60s, early 70s. And so the families got the sort of boost to income when white women entered the labor force, and it helped white families' incomes go up, whereas black families did not get as much boost to the income because a lot of the black women were already working. So in the full report, which you can find on the Brookings website, there is a split out of what's happening between black men, black women, white men, and white women. And then it also, and it's probably partly related to that, there is this decline in marriage rates which does have a negative effect on family income in the Black community.
Great, thank you, Julie. Do we have two other questions? Bill and then the lady.
I'm Bill O'Hare with the Kids Complex at the Annie Casey Foundation. It's primarily for Don, I guess, but it may be broader. First of all, I'd say thanks for putting this data together. I think it's really useful and helpful to get it all in one place and kind of have a good vision of it. But I think looking at the 85 to 2004 trends really missed the major point that your data underscores. There was no improvement prior to 93, and there was no improvement post-2000 except for some minor Hispanic improvement. So the real point is this 93 to 2000 period was the golden era for child well-being, or improving child well-being, not only for kids overall, but particularly for Black and Hispanic kids. So my question is to you or others, first, do you agree with that assessment? And secondly, what did the nation do during that period that was so useful for improving child well-being?
It's interesting. I looked back at some of those too, and there are about 5 or 6 indicators since 2001 that have increased. And obesity would be one of them where the gaps have narrowed, and attachment to work and some other things. Don might elaborate, but it is interesting to sort of look at the trends that Don has in terms of how the rate of improvement over the different time periods, for sure. So that's one question we'll hold, and then the ladies' question.
Karen Schulman with National Women's Law Center. There was a comment that the TANF money has stayed constant while the rolls are going down, but I think it's also important to point out that child care funding, which has been one of the most important resources to help families who move to work, has been flat funded, which has been essentially flat, which if you take into inflation, it means it's been going down, and states have had less reserves to draw on from TANF. So I think it's important to point out that essential funding for helping families move from welfare to work and to help families gain more income and help with the well-being of children has been steadily eroding. And I guess just another question. I'm sorry. There was some comments about the assessment for Head Start, and there were concerns about how appropriate that was for Hispanic children. And I was just wondering from the experience in New Jersey, and Miriam, if you could speak about whether you know of any more successful approaches and assessment methods for that are appropriate for children. English language learners.
Right. All right. First, to Bill's question, which is it's interesting to see on the time periods. It could be some of the results lag the policy implications of the investments have a payoff after the time period, or is it the case that what you learn from time periods in and of themselves becomes too positive? Did any of the panelists, starting with Don, have a thought on that?
Yeah, well, I guess clearly both are possible. And there are a lot of trends here, and it's quite complicated, and so there are some trends where the gaps were closing more rapidly in the more recent years. I think, though, there are certainly important trends where the gaps were closing more in the 90s and certainly since 1993, and that sort of period that followed the next seven years or so. I guess in terms of policies, first I'd say something that's not about policies for children, but just something about economic policy. That there are improvements clearly in secure parental employment and in poverty. And I'm sure that there is a lot of debate certainly about the extent to which welfare reform may have contributed to those versus a myriad of other kinds of changes that were occurring in the economy. And clearly when families have more money, other kinds of things are going to improve for children as well. So if the gap in particularly the low-income gap, the poverty measures, could redound through other indicators as well. In terms of more specific policies directed toward children, I think it's clear that the early education policies, Head Start, other policies that people have mentioned made a big difference, particularly for African American children, less so for Latino children, but that's an area where there have been important policy changes and big changes in these gaps. Third was in health insurance. That's an example of how you describe the situation with increases, but particularly for certain groups. In this case, we see increases with the state children's health insurance program. I mean, there's a trend. We have a large national program, enormous, important resources being invested, and you can kind of see that. You can see a very immediate response with enrollment of children in health insurance programs, and particularly for Hispanics, narrowing that gap over the next period. So I guess that's it's hard to get into more specific indicators sort of off the top of my head. But I would say one other thing, and that is that sometimes we look at these trends and you see a trend and you think, wow, that's going to continue forever. And clearly that's not the case, as you were pointing out, Bill, for some of the trends and for the overall. And so I think that it's important to us to think, as we think about the future, insofar as public policies have improved the situation and narrowed the gaps over the last 10 or 15 years, that we cannot assume that that's going to continue indefinitely. And in fact, for those improvements to continue may require additional increases in resources. Insofar as those gaps are closing because we're devoting more resources to children, it may require additional increments in resources to continue to narrow the gap. And if we don't do that, we may see more of a flattening out in many of these indicators.
Great. All right. And as we're at 12:15, I'm going to have Miriam and Dr. Youngblood have the last word, both on on either of the two questions. So
Okay.
Miriam?
I just, I had sort of the same thinking. Okay, there was a golden era here, and I just want to emphasize again during that time period that those were still very modest gains in the well-being of Hispanic children and African American children, and I think there's something to be said, that the economic period was good and there was a complementary investments in kids programs, but we have to have a strategy that's better than a decade. And if we employ those same strategies, we're not going to get there. And I think we need to be very focused on what are the vulnerabilities and really start to have a public policy conversation about focusing our attention on the most vulnerable kids. And I think the solutions were talked about, Dr. Youngblood talking about building equity into systems, into education systems, and really getting more voices and more people focused on those conversations. Is the strategy for eliminating these gaps. I think it can be done, but we're not there. And so it's important to look at that time period and good things happen and investments in the economy play an important role, but we're not at the point yet where we have the real issues around culture and language and equity and issues around immigration and the success of TANF policies really making some of the most vulnerable kids in our country less likely to access important safety net programs. But those need to be the focus of the conversation for the majority, not just the minority, of organizations like NCLR and NBCDI that have this as a priority in their agendas. On the issue of assessment and Head Start, I think the issue of assessment is complicated at NCLR. We support assessment, good quality assessment. We think it's an important part of education programs, of good quality programs, including early childhood programs. We were very concerned about the Head Start national reporting system with respect to some of the cultural and linguistic cultural bias and issues around language inherently in that assessment. Some of that was exposed because the NRS was building sort of on a foundation, on a very weak foundation in general on how we assess ELL kids and then what's appropriate for assessment of young children in general, including what's developmentally appropriate. I'd say, we need to go back to, there is a body of research that's showing some things that are very hard to do when you want to do large-scale assessment, including for accountability purposes, things like portfolio assessments, multiple, looking at various indicators. I think it's inherent that we be assessing kids in native language. We shouldn't be looking towards any type of assessment system, including for accountability purposes, that is building an inherent bias around the scores in English is what matters most, and those gains, particularly in the areas of early literacy, where we know that there's a direct relationship between the gains that kids are making in their home language to their later reading proficiency and reading comprehension in English. Be very concerned about what we saw in Florida, what we're seeing in Florida now with respect to assessment, a real disincentive for programs to be able to serve English language learners. Just the whole issue of creaming. I mean, I would be concerned about serving an ELL child in my Florida pre-K program, and then around the real disincentive for these kids to have access to instruction in their home language. So. There are not a lot of answers there. There's some. We need to do a lot more in terms of research and development in this area. And Norma's here, and she's been really trying to spearhead those efforts in the department.
Great. Thank you, Miriam. Last word, Dr. Young.
Yes, and we've also seen modest or incremental improvement in gains for our Latino populations in New Jersey. We attribute that, we think, to conversations around improving the funding and also the quality indices related to community daycare, community providers who overwhelmingly educate many of the minority students in New Jersey. So that investment in community providers who are more likely to hire and employ and retain people who speak the native language and who come from the same ethnic backgrounds as the children they're educating, we see that as a critical part of, again, being able to advance Latino growth in relation to the outcomes that we're looking for.
Great. Thank you very much. Please join me in thanking all of our panelists. A reminder, both the report is online. There's flyers on the report and a bunch of information on both the Foundation for Child Development and New America, as well as the USA Today article yesterday on Don and Suzanne's report. Thank you all very much for coming. We want to invite you on April 3rd back here for the 2008 Child Wellbeing Index, so you'll be receiving more information on that. We are adjourned. Thanks again.